welcome, welcome, and welcome our guests from Ukraine. My name is Hugo, Hugo Keuzenkamp. I am the General Director from Basalt. So Basalt is the largest rehabilitation hospital in the Netherlands, and we have a budget annually of about nearly 100 million euro. We have about 900 full-time equivalent employees, but many people in the Netherlands work part-time. So in total we have more than 1,000 employees. Basalt is an institute for rehabilitation in a broad sense. The strategy of Basalt for the next years has one important issue that's general for the Netherlands, and in a sense in Ukraine it will be also relevant, and that's not enough employees and an increase in demand for care. So this line is the demand for care, and this is the number of potential employees. So in the Netherlands the labor force will be a bit more or less stable, and demand for healthcare is growing because of an aging population and also because more and more possibilities appear. So how to deal with this increasing scarcity? And in Ukraine it has a different background, but this scarcity is the strategic problem for nearly all Dutch healthcare providers. And for that reason there's in Basalt a program, passende zorg, and that's countrywide. What are we willing to treat, and also where can we restrain ourselves, what's not needed? And in order to make such decisions we have to know what has most value added. So that's value-based healthcare. And another theme that's important, and that's in the Netherlands I think more important than in many other countries, is shared decision making. This is a cultural thing in the Netherlands that is different from I think Belgium, Germany and other countries. Although in most countries you see that the patient is becoming more important in the decisions. Basalt at Home is a strategic program. We try to get people as fast as possible out of the clinics. So they have to recover as much as possible at home, within their own environment. This is also for Dutch hospitals, not only for Basalt, but also hospitals, a goal to decrease the stay at length. And today in many hospitals you get a new hip and go the same day home. It's cheaper, but also better. And better because in the hospital you get infections, and in the hospital you are passive. So at home you must be more active. One element of our strategy is our place in the health system. So we are dependent from hospitals, but we are also dependent from general practitioners. So there's a whole system, and Basalt is a part of the system. Finally, lifestyle is important. For recovery, you should not smoke, you should not drink, you should practice as much as possible. And then we have three more elements of our strategy, and that is first of all provide attractive work to our employees so that they stay with us. Diversity is also of increasing importance. Our clients are from all kinds of cultures, and we also try to get employees from different cultures. Then just a bit about the Dutch healthcare system. Our system is called a system of regulated competition. So, for example, hospitals are private. They're not state-owned, they're private institutes. In a certain way they have to compete. And when a hospital is performing badly, then it may go bankrupt. And private means it's not state-owned. And Basalt, for example, it's not state-owned, it's a foundation, in Dutch a stichting. There's nobody owns the stichting, nobody owns Basalt, but Basalt has its own expenditures and income and has to make sure that the income is higher than the expenditures. Before you go to the hospital, you have to go to the general practitioner. As a citizen, you cannot go directly to the hospital. If at Basalt we accept a patient that has not been seen by a general practitioner or by a general hospital, then we don't get money for that. In the Netherlands, a very big part of health care is about elderly care, so houses for elderly persons. And it's here much bigger than in Ukraine. Next I will step to where do we get our money from? And that's from the insurance companies. And in the Netherlands, all citizens, we have 18 million citizens, they all have a compulsory health insurance policy. And we can choose every year to go to another insurance company. So competition between hospitals and competition between insurance companies. And there's a very intelligent system for the insurance companies that makes it possible that if I'm very ill, if I have cancer or an unpleasant disease, and I want to go to another insurance company, they have to accept me, even if I'm a bad risk, but they get extra compensation. And then the game between the supplier, so the hospital or Basalt, and the insurance company. I will explain how that works. So I have to negotiate every year with insurance companies, with all insurance companies, how much money we can get next year for treating their clients. And this budget is more or less fixed. The patients that we treat from this insurance, they, of course, they cost money, and they get a code, and this code is made up of all the activities that you are doing. So if in our hospital, the doctor and the physiotherapist, they write down what they are doing in order to generate a code by which we can send the insurance company our bill. And for a general hospital, it's relatively easy. There's a new hip, then I will send a bill to the insurance company of about 6,000 euros. In the rehabilitation hospitals, it's more difficult because we find it more difficult to allocate our costs to all the patients. But in general, it's the same idea. And now when this insurance company, I negotiated a budget of 20 million euro for next year, but we treat less patients than we expected, well, then it's bad luck for us. Then we get less money than this 20 million. On the other hand, when we get more patients and we exceed this 20 million budget, then it's also bad luck for us. Yeah. So there's an incentive for us to not to overdiagnose and overproduce. And we also have to try to treat patients and not to let increase waiting lists. So it's a difficult game. But it's, worldwide, there's no ideal, there's no perfect system. And I think this is a system that works fairly well. And all Dutch citizens have access to hospitals. The hospitals are of a relatively good quality, and people have to work hard, but it's fine. It's okay. So if you compare Dutch healthcare with other countries, what are other differences that you see? One of them is we have a fairly well-advanced electronic health record system. The great advantage of electronic health record is you can start to measure things. The elderly care in the Netherlands is extremely expensive. That makes the Netherlands stand out. And this is when I was in Lviv in early June. And I was honestly very impressed by what I saw, and I hope that we can help you to develop that further in Odessa and Dnipro. So I wish you a very good time here and to improve healthcare in Ukraine. Thank you.